So today we're going to do a little laser hair removal on the upper lip and on the chin. So laser hair removal only does dark hair. White hair, you really need to do dermaplaning or electrolysis. Dermaplaning is temporary, but electrolysis is permanent, and that is hair by hair removal. When you have a dark hair, you actually have a target for the laser. So the chromophore is melanin in the hair. And when you do the laser, we're hitting it in the root. So the base of the hair bulb is our target for the laser. Very good. So we're going to start on the upper lip. So we're going to start here. Very easy. It's about a centimeter. And you can see when you look in the camera, where the crystal is, that is where the laser is coming from. This metal is just a chill tip for comfort, but you can see the laser is not going to come through the metal. It's just where the crystal is, which is a square centimeter. So there needs to be some overlap when you treat here with the laser hair. So we're zapping here. We're just going to zap in a line. You can kind of start to smell the hair. And then these are hairs that have been targeted by the laser. So it's going to get the hair that's in the growth cycle and get rid of it. Not all hairs are in that growth cycle, so that's why multiple laser treatments are needed. That's looking good. Smell of success. Love it. Good here. So you do want to see just a little redness around the hair follicle. We call that perifollicular erythema, a little bit of redness, and that's a perfect treatment. You shouldn't see any blisters or anything too crazy. So our upper lip is done. We're going to come in and do the chin a little bit down here. Yeah, we had some surprise hairs right there. That's why I tend to treat the whole area to make sure that we get rid of those hairs. Yep, found some. So laser safety, if you're working with lasers, you want to have the appropriate protective equipment, which is goggles that block the wavelength of the laser. This is the luminous light shear, and it is an 800 nanometer diode laser that is going to target the melanin in the hair. This is not an appropriate laser if you are darker skin type. Then you need an Nd:YAG laser, because that bypasses the top pigment layer and goes deeper into the skin to hit the hair bulb without any destruction to the melanocytes that are in the superficial layer in the epidermis. Here we go. So the nice thing is once she's done, we're going to apply some moisturizer, some sunscreen. If she has any irritation, she can use some over-the-counter hydrocortisone. Oftentimes that's not necessary. This should not be painful. If there is any pain associated, she needs to call the office, because that can be a sign of infection.